The Lagos state government in southwest Nigeria says it is investigating a case of suspected Ebola infection in the state. Nigeria has so far been spared the ravages of the Ebola virus, which has been spreading rapidly in parts of West Africa. But health ministry officials in the state say they are investigating a Liberian man who is visiting the country and has shown symptoms of the virus. Officials are not disclosing the identity of this individual, but simply say he is a 40-year-old Liberian who works for a West African organization in Monrovia. We have now learned that the Liberian man actually works for ECOWAS. He's said to have arrived Lagos last Sunday and checked into a private hospital, reporting to be ill with symptoms of the virus. Take a listen to how Special Advisor to the Lagos State Governor on Health explained the situation.
2 days ago, that is Tuesday, July 22nd, the Lagos State Ministry of Health received information concerning a suspected case of Ebola virus disease from a private health facility. Details of the suspected case were obtained from the health facility, and this includes that he is a 40-year-old Liberian working for a West African organization in Monrovia, Liberia, who arrived in Lagos on a flight from Monrovia via Lome on Sunday, July 20th at about 4 p.m. History taken revealed that he had no contact with any case of Ebola virus disease. He did not visit any persons with Ebola virus disease in any hospital, and neither did he partake in the burial of any persons who might have died of Ebola virus disease. However, on account of his living and working in an endemic region of Ebola virus disease, which is Liberia, and the presentation of the non-specific constitutional symptoms and signs of the disease, which include fever, malaise, body aches, vomiting, diarrhea, etc., that are associated with the disease, a high index of suspicion was raised. And based on this, the patient was admitted and detained on suspicion of possible Ebola virus infection, while blood samples were collected for testing, and this was initiated with samples sent to the virology reference laboratory at Lagos University Teaching Hospital in Idiaraba. Blood samples were also sent to a World Health Organization reference laboratory in Dakar, Senegal, which is actively in process, and the results are still pending.
Now, the result of that test is expected in the next couple of days and will confirm whether this is a positive case of Ebola. For now, the individual is said to be responding to treatment and showing signs of remarkable recovery. The government is asking people not to panic, saying it is put all the necessary facilities in place to check the virus.
Contact tracing has started. Lagos Mainland Hospital has been identified. We have cordoned off. We have created isolation units there. We have deployed doctors there. Our doctors, the federal ministry has assisted by giving us the personal protective equipment. They brought 30, and they're bringing 20 more, and 250 more, and we're procuring other gadgets to secure anybody that's going to be in contact with this patient or any suspicious case that comes thereafter. We have mobilized the Health Facility Monitoring Agency to get in touch with the private sector, which is their purview, to do some rapid sensitization. We're giving out IEC materials, informative, educative, communicative materials to the private sectors through HEFAMA. We're sensitizing because they're the first point of call. A lot of people will found that may end up going to the private sector, as is the case here. Our own staff, our facilities have been on standby since March of this year when the first scare came on. So we have been ready. We have had all kinds of measures put in place. So we're now focusing on the private sector to make sure that they have the same resources as we do to curb this and keep it under control or from spreading.